Breast cancer really does impact the whole you. I feel like a lot of times people think, breast cancer, that's the easy cancer. You can remove your breasts, they're external. And you and I know, and all of us realize that that is ridiculous. There's so many things that breast cancer impacts. There's really three main categories: physical changes, which we'll talk about, especially relating to muscle mass tonight, emotional changes, not only in worries, fears, anxiety, depression, but also a lot of things that can be affected from our hormone changes, especially related to different hormone positive breast cancers. So take a look at the piece on the right, my image. This is not comprehensive, but think about the different systems of the body that are impacted by breast cancer treatments, as well as just the fallout of how your body changes going through all of these steps. So things like your hormone and endocrine system, your thyroid, your vitamin D level, that all happens to just age. Your body ages as you go through a lot of these treatments. So those numbers can be different than maybe a healthier peer that's never gone through breast cancer of the same age. Gut changes, internal as well as external. Chemotherapy, as many of you know, causes a lot of changes to your gut system, which we know 70% of our immune system is actually in our gut. So a lot of times we're immunocompromised in different ways because the chemotherapies and other treatments, medicines that we take wipe out the lining of our gut. I also put belly fat on here. Many of you know with hormone changes and you don't have the normal female hormones, that you have a little bit more of a male figure. And a lot of women post breast cancer in the hormone positive and hormone negative categories complain about belly fat. They say to me, Sami, I have never had the fat here in my body. It's just really a massive change. Other areas, brain, cognition, the brain is neuroplastic. And so when we don't use it in the same ways that we might have used it before, for various reasons, we have a little bit of a difficulty with things like short-term memory, a lot of things with processing. A lot of our breast cancer survivor community reports that they just don't feel like they can manage the number of tasks and the complication of tasks. A lot of our oncologists will say that they feel that there is about 10% difference in our cognition from a regular regimen of chemo. If you're a high functioning, technical executive, that may change how you calculate in your brain. If you're a busy working mom, it may mean that you have to go to the grocery store with a list when before you could walk through and remember everything you needed. If you're an older adult, maybe there's sometimes you have to write lists on everything. You have to write lists on taking your medicines. You have to write lists on the things that you're supposed to do. Often people tell me, I just can't multitask the way that I used to. And we know that a lot of the things that happen from breast cancer do affect, example, our brain. Certainly a lot of the other organs are affected. I think the pancreas is also a very interesting aspect because a lot of things our insulin production has changed. We have different aspects of metabolic syndrome, which also affects our energy, our fat gain, etc. Our bladder, when we don't have the same muscles or strength, it can affect how our bladder or bowels function. Additionally, things like joint pain, neuropathy, balance, toenails, fingernails, I don't even add bones. These are all of the things that can be impacted by breast cancer. And a lot of you here are saying, like, I have multiple of those. I put aging on here, not with a question mark that we don't think it affects us, but I don't think we really understand the accelerated aging impact of breast cancer. And I want to show you guys some more recent statistics today that I think are really helpful. People say all the time, why do I feel so old? Well, it's not just because you have gone through breast cancer, it's because your body has physically changed through breast cancer. The number one reason is loss of lean muscle mass, that strength muscle that gets us out of a chair, that strength muscle that helps us balance. It helps us carry small children or grocery bags or anything else that we do when we're up and moving. I think it's important to understand that women after the age of 30 lose about a half a pound of muscle mass per year just with the natural aging process. After breast cancer treatments, so looking at how the body ages, okay, we know that normal half a pound per muscle per year, think about 10%, right, in a decade. We know that this really accelerates in a shorter period of time after breast cancer. So what's the percentage of muscle loss related to chemotherapy? I realize this is a big time frame, but in 12 to 52 months, thinking about these longer term chemotherapies that a lot of you have gone or go through, or in the metastatic setting are still going through, we see that almost 7% of muscle loss happens. And you may look at that and think 2 months of just chemo and I can lose up to 7% of muscles. In severe cases, the answer is yes. When you're hormone blocking drugs, within 3 to 12 months, so in just 1 year of hormone blocking drugs, you're going to lose somewhere between 5 and 6% of your lean body mass. So if you come in the door and you weren't active and exercising, especially in the strength component, you are going to be losing from whatever your baseline is. The good news, and we'll talk about this, is controllable. But this is something that a lot of people come to me and say, I didn't know this during treatment. And to Tia's point, we certainly are working on better education during, but it doesn't matter. We have to look forward, not back. It's just understanding why the body changes as we go through a lot of these treatments. The natural aging process, so 120 months in 10 years, you typically only lose about 5%. So look at that comparison, guys. In 12 to 52 months, you're losing 7%, but in 120 months, you're only losing 5%. The number one reason that most of our physical challenges come to exist, loss of lean muscle. Good news is it's the favorite thing that I want to talk about because it's the one thing that we can really improve. So let's get started with a little bit of movement. We're going to move around a little bit tonight here at my home in Kansas City. So please move a little bit with me if you want to. I'm moving, you guys can stay right where you are, but we're going to talk about building lean muscle first. So I'm going to stop sharing for a moment so you guys can see me really well. I'm having a little bit of sunlight come in, so welcome to my happy apartment. So first thing I want you to do is sit right where you are. Pull your shoulders back. Take your chin, neutralize your chin so your shoulders aren't up, your chin's not up or down. If you've got something in front of you, your computer, try to set it to the side or onto your thighs. Roll those shoulders back, and let's pull the belly button in and engage our posture. So the number one thing you can do when you're seated is actually adjust your body positioning, not to this position, not to the computer, the phone, or the Netflix, but sitting up straight. In the breast cancer world, a lot of times our shoulders are impacted because of the pectoral changes, also from ports, but mostly breast surgery and reconstruction. So the first thing that we're gonna do is we're gonna take our arms, we're gonna lift them up to parallel if you can. We're gonna open our pinkies up wide, squeezing our shoulder blades together. Bring your hands back in. If you can, you're gonna reach straight up to the ceiling, back down to 90 degrees, pull those pinkies back out, bring it back in and down. We're gonna add some breath. We're gonna inhale up, exhale pinkies out, inhale arms in, exhale arms up, inhale down, and now exhale all the way up, pull those shoulder blades back and release. One more time, inhale up, exhale, pull those pinkies back, squeeze your shoulder blades, inhale together, exhale up, inhale halfway down, changing it, exhale, pinkies out, squeeze those shoulder blades, inhale together and all the way up. Now we're gonna do 5 big lifts all the way up together. Inhale up and exhale down. Make sure you got that belly button in, inhale up and exhale down. A couple more times, guys. Inhale up and exhale down. 2 more, inhale up. Big breath, exhale down. 1 more time, guys. Inhale up and exhale down. Just roll those shoulders a couple of times. I find like these just 1-minute movement sessions, especially if I'm stuck on Zoom or a computer, or I'm really tired at the end of the day, are really simple. They engage a lot of really important muscle, but they're really easy to do and they're great for range of motion.